If you are over 60 and your legs have been giving you trouble lately, I want you to stop scrolling for the next few minutes. I am not talking about tired muscles or bad knees here. I am talking about your heart. Your legs sit at the very end of your circulatory system, which means they are often the first place your body sends a warning when something upstream, closer to your heart, has started to go wrong. Most people wait for chest pain before they think about their heart, but by the time chest pain shows up, the arteries have often been narrowing quietly for years. Your legs, on the other hand, tend to speak up earlier. Today I am walking you through 7 specific signals your legs may be sending you right now, in the order I would check them if you sat down in my office. Stay with me through all 7 because the last one is the one almost nobody checks for, and I will show you exactly how to test it yourself at home in under a minute. Before we get started, a quick note. I have put together a research-based guide with heart protective habits for men and women over 60. It is free in the description below this video if you want something to keep and reference later. Sign 1, leg pain that shows up when you walk and fades when you rest. Let's start with the most classic signal, one that gets brushed off constantly. You walk to the mailbox, up a flight of stairs, or across a parking lot. Partway through, your calf, thigh, or hip starts to ache, cramp, or feel heavy. You stop, you rest for a minute or two, and the pain eases. So you assume it is just old age catching up with you, or maybe arthritis settling into your hip. Here is what is actually happening underneath. When you walk, the muscles in your legs demand more oxygen-rich blood. If the arteries feeding those muscles are narrowed by plaque, they cannot deliver enough blood to keep up with the demand, and the muscle tissue essentially cries out from oxygen debt. That cry is the pain you feel. It is called claudication, and it is one of the clearest calling cards of peripheral artery disease, a condition where arteries throughout the body, not just in the legs, are coated with the same fatty buildup that clogs the arteries around your heart. It sounds frightening, but naming it is actually the first useful step, because once you know what to call a symptom, you know what to ask your doctor about. Researchers examining patients with known cardiovascular risk factors found that peripheral artery disease was present in roughly 1 in 10 people overall, and that number roughly doubles once you pass age 70. That is worth pausing on. Hypertension and unhealthy cholesterol levels showed up in the large majority of those patients, which tells you something important. The same habits that protect your heart also protect your legs because they are protecting the very same arteries. Other work following patients with confirmed peripheral artery disease found their risk of dying from coronary heart disease was several times higher than that of people with clear, healthy arteries. That is not a small statistical footnote. That is a direct line from your legs to your heart. The fix here starts with a conversation, not a treadmill. Ask your doctor for a simple ankle brachial index test, which compares blood pressure in your ankle to blood pressure in your arm. It takes about 10 minutes. It will not hurt at all. So ask yourself honestly, has your walking distance quietly shrunk over the past year, and have you been telling yourself it is just your knees? We will come back to how these 7 signs connect to one bigger picture, but first, let's talk about the second sign. This one hides in plain sight every single morning when you put your socks on. Sign 2, one leg or foot that runs colder than the other. Have you ever noticed that one foot feels chilly while the other feels perfectly normal, even under the same blanket? Many people assume this is just poor circulation from sitting too much, and they reach for thicker socks and move on. The real explanation can be more specific than that. When an artery supplying one leg narrows more than the artery supplying the other, that limb receives less warm, oxygenated blood. The skin temperature on that side drops measurably compared to its twin. This asymmetry is a pattern doctors specifically look for during a vascular exam. A general, whole-body chill usually points to something like thyroid function or room temperature. A one-sided chill points toward a blocked artery instead. A survey from the American Heart Association highlighted that most people are familiar with heart attack and stroke risk, yet very few recognize peripheral artery disease as a related warning sign, even though it shares the same root cause and often shows up years before either of those bigger events. The simple fix tonight is easy. Compare your feet with your palms, flat against each one for 10 seconds, one foot after the other, and notice if there is a real difference. If there consistently is, mention it at your next appointment, even if it seems minor. Try this yourself this evening. Place a hand on each foot and ask which one feels warmer to you. Sign 3. Swelling in your ankles or lower legs that builds through the day. This next one shows up gradually enough that people often do not notice it until their shoes stop fitting the way they used to, or until they press a finger into their shin and watch a small dent stay there for a few seconds. That lingering dent has a name, pitting edema, and it deserves your attention. Here is the mechanism. Your heart's job is to pump blood forward efficiently. When the heart muscle weakens and cannot pump with its usual strength, blood returning from the legs through the veins starts to back up. Fluid gets pushed out of the blood vessels into the surrounding tissue, especially in the lowest parts of your body where gravity pulls it. That is why this swelling is often worse by evening and better after a night lying flat. It is one of the more direct signs that the heart itself, not just the leg arteries, may be struggling to keep up. Data from health organizations tracking heart failure note that swelling in the legs and feet is frequently the very first symptom people notice, sometimes months before they are ever formally diagnosed. To be fair, swelling has other everyday causes too, including long flights, salty meals, or simply standing on your feet all afternoon, so one puffy evening after a wedding is not automatically cause for alarm. Context matters here. What matters more is the pattern, swelling that returns night after night, that climbs higher up the leg over time, or that shows up alongside fatigue and a shortness of breath you cannot quite explain. In some cases, the swelling appears alongside a sense of breathlessness when bending forward, a pattern cardiologists call bendopnea, and if that combination shows up together, it is worth mentioning to your doctor without delay. The simple fix is to start tracking it. Press your thumb into your shin bone each evening for 5 seconds and note whether an indentation remains. Weigh yourself at the same time each morning, because a sudden gain of a few pounds in 2 or 3 days often means fluid, not fat. Ask yourself this: are your shoes fitting tighter by dinner time than they did at breakfast? Let's pause here for a second, because I want to hear from you before we move into signs 4 through 7. If any of these first 3 have sounded familiar, type the number of the sign in the comments right now, 1, 2, or 3, so I know exactly which ones to cover in more depth in a future video. I read every comment, and it genuinely shapes what I make next. Sign 4. Leg cramps that wake you up at night. You are asleep, and suddenly your calf seizes into a hard, painful knot that jolts you upright. Most people chalk this up to dehydration or low potassium, and sometimes that is exactly right. But researchers studying nocturnal leg cramps in adults over 60 have found a consistent overlap with cardiovascular risk factors, sedentary time, and vascular disease, even though the relationship is not as clean or universal as claudication. What seems to happen in at least some cases is that reduced blood flow through narrowed vessels leaves the calf muscle more irritable and prone to involuntary contraction, particularly overnight, when circulation naturally slows during rest. One large population study found that people reporting moderate to severe nighttime cramps were also more likely to report other markers of poor cardiometabolic health. A separate study of adults over 60 found that a sedentary lifestyle raised the odds of frequent night cramps nearly tenfold. This does not mean every cramp is a heart problem, and I want to be honest with you about that nuance rather than scare you unnecessarily. Plenty of cramps come from nothing more than dehydration, a long day on your feet, or a medication side effect. The fix is layered. Stay hydrated during the day and gently stretch your calves for 30 seconds before you turn off the light. If your legs cramp mid-cramp, straighten the knee and pull your toes gently back toward your shin, which usually breaks the spasm within a few seconds. If the cramps are frequent, severe, or new, bring them up alongside any other signs on this list rather than treating them in isolation. Ask yourself, Are these cramps a once-in-a-while nuisance, or have they become a near-nightly pattern over the past few months? Sign 5. A cut or sore on your lower leg or foot that is taking forever to heal. Out of all 7 signs, this next one worries me the most when I see it in a patient, because it tends to show up later in the disease process. Think about the last time you scraped your shin on a coffee table or a garden bed. A small scrape from a shoe, a blister, or even a minor scratch on the shin or top of the foot should heal within a couple of weeks. When it lingers for a month or longer, or when it looks pale, dusky, or simply refuses to close, that is your tissue telling you it is not getting the blood supply it needs to repair itself. Healing is an incredibly resource-hungry process. Your body needs a steady delivery of oxygen, white blood cells, and nutrients to rebuild damaged skin, and all of that arrives through the same arteries we have been discussing this whole video. When those arteries are significantly narrowed, wound healing slows to a crawl. In more advanced cases, it can stall out entirely. Vascular specialists describe slow-healing lower leg wounds as one of the more serious complications of peripheral artery disease, one that can eventually threaten the limb itself if the underlying blood flow problem is not addressed. This is not meant to alarm you. It is meant to move you toward action while action is still simple. The fix here is not to wait it out. Any wound below the knee that has not visibly improved within 2 weeks deserves a doctor's eyes, not another round of ointment from the drugstore. Check your shins and the tops of your feet tonight, running your fingers over the skin, and ask yourself honestly whether anything there has been slower to heal than it should be. We are now over halfway through your 7 signs, so here is the bridge back to the bigger picture I promised you. Every single one of these signals traces back to the same root cause: arteries throughout your body narrowing from the same buildup of cholesterol and fatty plaque. Your legs simply happen to be far enough from your heart that they often show the strain first, sometimes years before a cardiologist would otherwise catch anything on a standard checkup. Sign 6. Shiny, hairless skin or toenails that barely seem to grow. Look down at your lower legs and feet for a moment. Healthy skin down there usually has some fine hair, a matte texture, and toenails that need trimming every few weeks. When circulation to that area drops over a long period, the skin adapts in a very specific way. It thins. It takes on a smooth, almost polished look. Hair follicles stop producing because they are not getting enough nourishment to keep growing, and toenails, which are essentially specialized skin cells, slow their growth dramatically. Doctors are trained to look for precisely this combination during a physical exam because it develops slowly and painlessly. Most patients never notice it happening to themselves. A physician writing about vascular disease noted that removing a patient's socks and simply looking is one of the most underused diagnostic steps in medicine because these visual clues sit right there in plain sight during nearly every appointment, yet they get skipped when a visit is rushed. The fix is refreshingly simple. Look. Once a month, really examine your lower legs and feet in good light, comparing them to how they looked a year or 2 ago, and mention any changes in skin texture, hair loss, or nail growth at your next physical. A phone photo taken every few months can be surprisingly useful here, since side-by-side comparisons catch slow changes that memory alone tends to smooth over. Take a moment right now and picture your own legs. Have they changed in texture or appearance over the last couple of years without you really registering it? Sign 7. No pain at all, even though something underneath may already be blocked. Here is the sign that surprises almost everyone I explain it to in the clinic, and it is precisely the reason I saved it for last. You might be sitting there thinking you are in the clear because you have none of the leg pain we talked about in sign 1. Unfortunately, that is not the reassurance it seems like. Research has consistently found that for every person with clearly symptomatic peripheral artery disease, there are roughly 3 to 4 more people walking around with the same degree of arterial blockage and no symptoms whatsoever. Their bodies have quietly rerouted blood through smaller side vessels well enough to mask the problem, at least for now. This matters enormously because painless does not mean harmless. People with silent, undiagnosed artery disease still carry a dramatically higher risk of heart attack and stroke, in some studies more than 6 times the risk of dying from coronary heart disease compared with people who have healthy arteries. This is precisely why relying on symptoms alone, waiting for pain, swelling, or a slow healing wound is not a complete strategy. The fix is a physical check you can do yourself tonight. Sit down, take off your socks, and gently feel for a pulse on the top of your foot, roughly in line with the gap between your first and second toes. Then check another pulse just behind your inner ankle bone. If you can find a steady pulse in both spots on both feet, that is a reassuring sign. If you cannot find one at all, or if one side feels noticeably weaker than the other, that is worth bringing to your doctor along with everything else we have covered today. Go ahead and try that check as soon as this video ends before you forget. Now let me give you a simple daily blueprint that touches on nearly everything we just discussed, something you can realistically fold into your routine starting tomorrow. In the morning, before you even get out of bed, flex and point your feet 10 times each to wake up circulation after hours of stillness. And if you take a blood pressure or cholesterol medication, take it consistently at the same time rather than skipping days, you feel fine. After breakfast, take a 15 to 20 minute walk at a comfortable, unhurried pace. Regular walking is one of the single best studied ways to improve blood flow through partially narrowed leg arteries over time. And it is also the same activity doctors prescribe as first-line treatment once peripheral artery disease is confirmed. Come afternoon, avoid sitting still for more than an hour at a stretch. Stand, stretch, or shift position instead, since prolonged sitting is one of the clearest lifestyle links researchers have found to nighttime leg cramps in people over 60. When evening rolls around, do your quick self-check, a glance at your skin, a press on your shin, a feel for your pulse. Jot down anything unusual in a small notebook, so patterns become visible over weeks rather than getting lost day to day. Right before bed, elevate your legs on a pillow for 10 or 15 minutes if you noticed any swelling that day, and keep your feet clean and moisturized, since dry, cracked skin heals more slowly when circulation is already limited. If you smoke, know that quitting is the single most powerful thing you can do for every one of the 7 signs we have covered today, more powerful than any supplement or cream on the market. None of this replaces a doctor's evaluation. It just gives your circulatory system consistent daily support instead of occasional attention. I want to share something with you now that I do not usually talk about publicly. Early in my career, I treated a patient, a retired mechanic in his late 60s, who came in for what he described as nothing more than tired legs after his usual afternoon walk. He had no chest pain, no shortness of breath, nothing that fit the picture we are trained to worry about first. Almost as an afterthought, near the end of the visit, I checked the pulses in his feet. On one side, I genuinely could not find one. That single 30-second check led to imaging. The imaging revealed significant narrowing, not only in his leg arteries, but in a vessel near his heart as well, something that had given him no warning signs beyond those tired legs. He went on to have the blockage treated before it became an emergency. Every time I think about how close that was to being missed, it reminds me why I take a full minute at the end of every physical to check feet, even when a patient insists their legs feel fine. He still sends me a card every winter. It is a small habit that has changed the trajectory of more than one person's life, and it costs nothing but a little bit of time and attention. I share that story with you not to frighten you, but because I would rather you check your own pulse tonight than wonder about it later. Let's bring this all together with a quick recap of the 7 signs worth watching. 1. Leg pain during activity that eases with rest. 2. One leg or foot running noticeably colder than the other. 3. Swelling in your ankles or lower legs that builds throughout the day. 4. Leg cramps that wake you up at night on a regular basis. 5. A cut or sore below the knee that is slow to heal. 6. Shiny, hairless skin or slow-growing toenails on your lower legs. And 7, the quiet possibility of blockage even when you feel no pain at all, which is exactly why checking your pulse matters regardless of how your legs feel today. None of these signs, on their own, means you are having a heart attack tomorrow. But together, they form a pattern. And patterns are what I look for, specifically when I am trying to catch something early rather than late. So here is my question for you, and I would honestly like to know the answer. Out of these 7 signs, which one caught you off guard the most? Tell me in the comments because I read through every single one and it helps me decide what to dig into next. If this video gave you something useful, do a fellow subscriber a favor and share it with someone in your life who tends to shrug off little aches and pains the way so many of us do. Send it to your spouse, your walking buddy, or that friend who has been complaining about tired legs at every coffee catch-up for the past year. A single share might be the reason someone catches this early instead of late. It costs you nothing more than a tap of your thumb. I will see you in the next one, and until then, take care of those legs of yours, because they are working harder for you than you probably realized. This video is for general educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always talk to your own doctor about your individual symptoms and health history before making any changes.